Hi, it's Dr. Nick back. Over the next couple of weeks, we're going to go through each of the 5 most common running-related injuries, starting with the first one and the most common one today, which is patellofemoral pain syndrome. It's a super fancy phrase for knee pain. As always, don't forget to like, subscribe, and share this video with someone who may need it. Now, before we get into patellofemoral pain, we're going to talk about the different grades of running-related injuries. Basically, what that means is at what point during your run do you have pain? 1 is going to be after training, 2 is going to be during your run, but it's also not restricting anything. So maybe we'll say discomfort. Grade 3 is pain during your run, but it also is going to limit how much you go, which is like limiting speed, limiting duration, things like that. And then grade 4 is just not being able to run at all. And this is a big stat that 40% of injured runners do not return to running, which as a runner is a pretty big number. And it's also a pretty big deal because running is our entire personality. Now, why do people get hurt while they're running? The biggest thing that I see is related to training, which means what is their training schedule look like? How much are they running in a week? And a lot of times you see this very commonly with new runners who do way too much, way too quickly. Whereas they're super excited, they run a ton of miles, they have minimal rest, they may not do any strength training, or they're increasing their mileage too much as the weeks go by. So how do you monitor your pain when you're running? One of the biggest ways that I do it, and the way I teach my clients, is through the stoplight theory, which means if you're taking your classic 0 to 10 pain scale, 0 to 2 to 3 out of 10, green means go, you're good, keep going. 4 to 5, in between that range, is your yellow light. Caution, but you could still go a little bit. Anything above that, we need to modify. And those modifications may be initially decreasing your distance, decreasing your mileage, decreasing how fast you run, things like that. The things we want to look at are, have they had any injuries in the past? Or what is their history? Did they recover from that injury as well? So all these are things we need to take into consideration. But in this particular case, we're looking at patellofemoral pain, which again is the most common running-related injury. Now, how do you know that you have this? Well, the biggest thing is that your pain worsens throughout the run. Your pain is located in and around the kneecap area. And the biggest thing that you see in your day-to-day life, which may be pain with going downstairs, squatting, or sitting for a long period of time, like if you're in the car for a long time. And what about the things you can't see? A lot of these people are going to have some sort of mental health issues, anxiety, depression, things like that. They're going to be worried about whether or not they go back to running. Again, look at that 40% of people who don't return to running. They're going to be scared of making things worse over time. And they may even have some hypersensitivity, which means things that may not usually be painful to that knee are going to be magically painful. Now, what do we also see? We also see weakness up into the hips, specifically moving into abduction, extension, and external rotation. You also see quad weakness with these individuals. You see it on both sides, not just the side that hurts, which is why we always train both sides. You'll also see some abnormal running or squat mechanics as well. Now, what does their running look like? Well, if you're looking from the backside, you might see their knees cave in a little bit more. You might see a hip drop. You might see their knees, get pretty close together. All those are going to probably look like patellofemoral pain. But again, everybody runs a little bit differently. That person may have no pain. But that's one thing that you want to look at, definitely, is how they run. How do you fix this? Well, one temporary way that you could do it is taping. You could do a tape job for the knee. The biggest thing with any sort of taping is that we don't want our patients to get too reliant on that. This is meant to be just like a temporary fix while we strengthen the other areas around the knee. The way that foot is landing may pull your femur, so that big bone in your leg, into what we call excessive internal rotation. That's going to be another big sign of someone with patellofemoral pain, or who may be at risk for patellofemoral pain. So what do we do for it? Well, we mentioned it before. We want to look for weakness in your quads. We want to look for weakness in a little bit in your hips. And then we also want to look at how your running looks. So gait mechanics. You should always be doing some strengthening if you're a runner anyway. So with extra emphasis on your quads and your glutes. So two of my favorite exercises are step down variations. One's going forwards, the other one's going to the side. Going forwards makes you focus on the control of those quads. Going to the side helps you focus on the control of the hips. Another great one is going to be a single leg deadlift with a dumbbell, kettlebell, something like that. Those are just two examples that I use a lot of in the clinic with my running patients and my knee patients. Now, I also mentioned we could retrain gait mechanics. How do we do that? There's three ways that we can do this for people with patellofemoral pain. The first one is using this cue that's called run with your knees apart. So it basically forces your hips into a little bit more external rotation. You can do that with the use of a mirror. Another way is to cue them to lean forwards a little bit more. What that does, it promotes a little bit more hip extension. And when you are transferring forces from one area to the biggest muscle belly that you have, it's going to reduce some knee pain and knee joint stress. The last way to do this is to increase your cadence. So basically, you're taking more steps during your run. How do you do that? Well, you can work on working with a metronome to get the timing down, so every time your foot hits the ground, you have that beat in your head then too. Now, why is that important? Well, when you have a higher cadence, there's less force being transmitted because you're taking shorter steps. You're taking more steps, which means you're spending less time on each foot. And with less time on each foot, you have less stress going up through the leg. So those are some of the ways that you can deal with patellofemoral pain if you're a runner. Next week, we'll dive into the second most common running-related injury, which is IT band pain. Thanks for watching. I hope this was helpful for you.